Hello students, Instructor Pamela here. I would like to give a Career Connect regarding inpatient coding. As an inpatient coder, you will be coding for a hospital facility, and inpatient coding is driven by the admitting diagnosis, which then creates the diagnosis related group, the DRG. And the DRG gives the insurance company as well as the facility a weighted amount of what they are expecting for reimbursement. So the DRG is a way for the facility to track its reimbursement on a monthly basis from the insurance payers. And the DRG is created from the EHR or the EMR or the healthcare program that you're inputting the data in. The DRGs came out around 1980 or so, and when they were first implemented for inpatient coding, the coders had to actually use a telephone and dial by number to get the DRG. So now they are actually produced by the program you'll be working on at your job. So awesome for that. But overall, coding always needs a diagnosis, which is the reason for treatment or visit, such as pneumonia, diabetes, fracture of the radius ulna. So those are diagnoses, and every single claim that you code from here on out always needs a diagnosis. Now, what makes inpatient special is there does not need to be a surgery included on the claim. Meaning, if a patient comes in for pneumonia and they're just treated with antibiotics and other medication therapy, there is no surgery done. So therefore, there's not going to be any surgery from volume 3 from the ICD-9 book inputted on the claim. So again, the only diagnoses that would be inputted on the claim would be the pneumonia. And that would create the DRG. It gets then submitted for review from the payer reimburses the facility, and then the remittance advice is sent back to the facility for payment posting to the patient's account. As a coder, you will be reading the discharge summaries as well as any other diagnostic labs that pertain to the patient's stay to look for any other additional diagnoses that may arise during the patient's visit as an inpatient. So when you go to your jobs, you will be basically doing the same functionalities when it comes to inputting your diagnoses into what we call an encoder, such as 3M. Opposed to using your books, you will be typing in the patient's diagnoses into another computer program. It will generate the codes. You pick the best code for the diagnoses and then input it into the patient's, of course, chart medical record for reimbursement. And again, inpatient coders work for hospitals. So if you are not hired as an inpatient coder, you will never utilize volume 3 codes. That's what makes inpatient coding a little bit clearer. Again, if you are an inpatient hospital coder, you will use your entire ICD-9 book, volumes 1 and 2, and volumes 3. But if you are not an inpatient hospital coder, you will always use your CPT book and never the volume 3 codes. So you can write yourself a little note on your volume 3 section in your ICD-9 book that you will only use these codes as an inpatient hospital coder. And with those codes, you will utilize volumes 1 and 2 for the diagnoses, and your computer program will create the diagnosis related group, which is communicated for reimbursement. So, thank you very much, students, for listening. Until next time, Instructor Pamela here. Journey well.